Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear a selection from an interview I did with Dr. John Dane and Gary Harbison. Dr. Dane is the state dental director, and Gary is the director of the Missouri Oral Health Coalition. They'll be guests on next week's Intersection. They spoke about some of the ways that oral health and physical health are interconnected. Here's Dr. Dane.
Oral cancer, oropharyngeal cancer, let's be specific about that. The HPV problems that have been increasing across the United States. We've had a 40% increase in oral cancer. Most of that has been due to the HPV virus.
And this is the human papillomavirus that we usually associate more with sexual contact.
With cervical cancer, right. What we're finding is that it's not necessarily in the younger population as it is in an older population. So you're going to begin to hear education and training and emphasis in dental offices recommending that teenagers get the HPV virus vaccine. I don't think you're going to find dentists doing the vaccines in their office, but you're going to be seeing promotions on that.
Huh. Interesting. I mean, in oral cancer, I'm not sure off the top of my head. What are the prognosis on oral cancers?
Well, two things happen with oral cancer is that, number one, it's usually found later than earlier because most people don't recognize the symptoms, don't go to their dentist to have it checked out. And so consequently, you may have a lesion that's developed on the base of the tongue. It's obviously a difficult area to do surgery on, a difficult area to get to.
So what can individuals who are listening do?
You can, when you go to the dentist, ask them if they're checking you to see if you've got oral cancer. And then if you've got kids, get them vaccinated.
From my perspective, it seems like every week another study comes out that shows a connection to oral health and some physical health condition. The strongest thing I could say about that is it's absolutely a truth that you cannot be completely physically healthy unless you also have good oral health. It's very easy if you have basic good oral health and you don't have problems to have the impression that it is all about kind of cosmetics, having nice, white, shiny, straight teeth. And that is an aspect of dental care, but the important part is really the public health issue. Communities that have poor oral health, people there are having trouble going to school and learning, they're having trouble getting jobs, keeping jobs, they're having trouble paying for dental care, and we need to get past that and get it in our heads that if you want to be healthy, you have to have good oral health care.
That was Dr. John Dane and Gary Harbison speaking about the oral health of Missourians. You can hear more from this conversation about the current status of oral health in Missouri and about possible future oral health policy next week on Intersection. The show will be a special from Missouri Health Talks hosted by me and will run Monday at 2:30 and 6:30 p.m. But for now, that's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.